Very good afternoon, everyone. I'm here, myself, Dr. Swati. I'm here to discuss the role of intravitreal dexamethasone implant as a primary therapy in diabetic macular edema. Since we all know the diabetic macular edema is the most common cause of vision loss in diabetic retinopathy, which can be treated by various options like lasers, anti-VEGFs, and corticosteroids. But out of these, intravitreal dexamethasone is not much studied as a novel therapy. So with this, we aim to evaluate the long-term safety and efficacy of the intravitreal dexamethasone implant for the treatment of diabetic macular edema in primary diabetic macular edema cases, with the objectives of to note the change in visual status, so to see the change in central macular thickness on OCT, its effect on IOP, and other complications arising from it. So we included total 30 cases, and these cases were all primary diabetic macular edema who had not taken any treatment prior. After the pre-op evaluation, those patients with increased central macular thickness were received intravitreal dexamethasone implant, and the post-treatment evaluation was done at first week, 1 month, the third month, 6 months, and at the end of 1 year, where the best corrected visual acuity, slit lamp examination, intraocular pressure, fundus evaluation, OCT, the fasting blood sugar, and the postprandial blood sugar were also noted and analyzed. So we found that the increase in the visual acuity was noted from the first week onwards, and it was maintained thereafter till the 6 months. And even there was significant reduction in the central macular thickness was found with the subsequent OCT we did after at the 3rd month and the 6th month. When we compared our results with the glycemic control of the patient, we found that those patients with poor systemic control were the one who developed diminution of vision or increase in central macular thickness at the end of the study. So altogether, we had 13.3% of persistent cases and 20% of recurrent cases. But on then again, on relating them with their systemic control of glucose, we found that they had a poor glycemic control, and there was no significant change in intraocular pressure was noted after receiving the injection over the study period. So with this, the results showed that the intravitreal dexamethasone implant is a safe and efficacious treatment modality as initial therapy for diabetic macular edema, which shows significant improvement within 3 months and was maintained till the end of the study without any significant complications. We also compared our findings with the related articles to find out the similarities and differences with other studies to derive conclusions, and all the studies shows the similar outcome of the same outcome what our study showed, except the difference was we had taken the fresh cases of diabetic macular edema, whereas the other study, they had included the cases which has persistent diabetic macular edema or there was a recurrence in diabetic macular edema. So to conclude, the intravitreal dexamethasone implant is a good option for diabetic macular edema as initial therapy. It improves visual acuity and decreases central macular thickness with the maximum efficacy between the 3rd and 6 months, which is maintained thereafter without any significant complication, with best possible results obtainable with good glycemic control. Thank you.